Physiowebseries Knee Complex Season 1. Let's begin with Series 3. In Series 3, we'll be continuing about the discussion of certain key concepts to remember, starting with gastrocnemius muscle. So, gastrocnemius, we have seen already the origin insertion of this muscle. It will have lateral as well as the medial head, and via the Achilles tendon will insert at the posterior calcaneus. So the lateral head from the lateral femoral condyle, medial head from medial femoral condyle, coming down to insert at the calcaneus. So it crosses the knee joint and the ankle joint. We know this basic concept. So, at the knee joint, this gastrocnemius provides small knee flexion torque during knee flexion, and at the ankle, it provides large plantar flexion torque. So, comparatively, gastrocnemius will provide larger plantar flexion torque and smaller knee flexion torque if compared knee and ankle in case of gastrocnemius. Other than this, it functions more as a stabilizing muscle, and as it stabilizes knee joint, this gastrocnemius along with quadriceps will stabilize the knee joint in early stance phase of gait. So this was about gastrocnemius. Next, moving on to popliteus. So popliteus, we know the origin from the lateral femoral condyle and the posterior horn of lateral meniscus to the posterior proximal aspect of tibia goes for insertion. So this muscle has the role to play in knee flexion. During early knee flexion, this will medially rotate the knee to unlock the knee joint. So medial rotation of knee will be done by popliteus to unlock it. That is during early knee flexion. This is important to remember. Again, during active knee flexion, this will deform the lateral meniscus as it has the attachment over the lateral meniscus, this muscle popliteus. This muscle popliteus along with semimembranosus will deform that lateral meniscus, that is, move it posteriorly during active knee flexion. So popliteus has got great role to play during early knee flexion as well as active knee flexion. Now moving on to the knee extensors, that is quadriceps femoris. Let's discuss about the origin and insertion of those muscles. So quadriceps, as the name suggests, what four muscles are included in this? Rectus femoris. Below that rectus femoris, we will have vastus intermedius, and at the sides will be vastus medialis and vastus lateralis. So vastus medialis again will have two parts, vastus medialis longus and vastus medialis obliquus. Those muscles can be appreciated in this diagram. So this is rectus femoris. Below the rectus femoris, you can appreciate, if we remove rectus femoris, below it there is vastus intermedius muscle, and at the sides of those vastus intermedius muscle, you can see there is vastus medialis and vastus lateralis. Other than this, we have VMO, vastus medialis obliquus, and upper part will be vastus medialis longus. So let's now discuss about the origin and insertion, starting with rectus femoris muscle. As it can be seen over here, originating from anterior inferior iliac spine, traveling this way to insert to the tibial tuberosity. So origin anterior inferior iliac spine and insertion to the tibial tuberosity. This was about rectus femoris muscle. Next comes the vastus medialis muscle. So let's have a look into obliquus and longus muscles in this. There are two groups. Why there is this two muscles in this, that is vastus medialis longus and obliquus? That is because of the distinct arrangement of fibers. If we see at vastus medialis obliquus, the fibers arrangement is little oblique. hence the name vastus medialis obliquus. Rest of the upper fibers are vastus medialis longus. So upper one forms the vastus medialis longus, lower fibers will form vastus medialis obliquus because of its arrangement, the fiber, muscle fiber arrangement. So important to know this as it has association with clinical aspect. So now the origin and insertion. Vastus medialis originates from intertrochanteric line, linea aspera, and the medial supracondylar line of the femur. So this will be the origin, traveling down to insert to the patella as well as the tibial tuberosity. So also inserts at the patella and the tibial tuberosity. This was about vastus medialis muscle. Moving on to vastus lateralis muscle, as can be appreciated in this diagram. So origin is again from intertrochanteric line, then the greater trochanter as well as the linea aspera and the gluteal tuberosity, going down to insert again to the patella as well as the tibial tuberosity. So origin and insertion. This was about vastus lateralis. Now let's see about vastus intermedius, which is below the rectus femoris, can be appreciated over here. Vastus intermedius, which originates from upper two-third of anterolateral surface of the femur, coming down to insert again to the patella as well as the tibial tuberosity. So origin is from upper two-third of anterolateral surface of femur, inserting to patella as well as the tibial tuberosity.